Today we are going to talk about the integrated medicine, how to combine the alternative and complementary medicine with the modern medicine in an evidence-based way. So the convergence of modern evidence-based medicine with the alternate and complementary modalities has prompted a paradigm shift in the healthcare. And today we are going to have the scientific rationale, the methodology, and the clinical outcome of integrating these diverse practices, highlighting both the benefits and the challenges. The evidence suggests that combining the conventional therapies with the complementary approaches can improve the patient outcomes, improve the quality of life, and potentially reduce the side effects associated with the standard treatment. Now, we know that modern medicine is characterized or is identified by rigorous or solid clinical trials and standard protocols, which has actually revolutionized the treatment of the acute and chronic illnesses. However, alternative and complementary medicine also are modalities such as acupuncture, Ayurveda, yoga, mindfulness practices, herbal medicine. They all have gained increasing management in a better way. When we talked about the evidence-based integration of the modalities, we know that recent clinical research has shown the potential for integrative approaches effectively. And randomized controlled trials have demonstrated that acupuncture, when used as adjunct to the pain management, it can reduce the opioid dependency, which are like opioid-like medicine like morphine, and also improve the functional recovery in the patients of chronic conditions or chronic pain conditions, as it was reported by Smith et al. I'll put the references at the bottom. Similarly, the mindfulness-based stress reduction has been shown to improve the symptoms of anxiety and depression in the patients with cardiovascular disease, and therefore complementing the pharmacological interventions of the modern cardiology as reported by Johnson et al. Now, when we look into the mechanistic insights, the scientific rationale behind the integrative medicine lies in the ability to modulate the physiological pathways through the multiple mechanisms. For example, herbal compounds may act synergistically with the conventional drugs by increasing the anti-inflammatory pathways, while practices such as yoga and meditation can modulate the autonomic nervous system and reduce the stress-induced hormonal imbalances as reported by Lee and Patel. Now, this multi-modal approach not only addresses the pathophysiology of disease, but also support the psychological and emotional well-being of patients. When we look at the clinical implementation, incorporating the alternative therapies into the clinical practice require a careful consideration of the evidence, the safety profile, and the regulatory standards. Healthcare providers are encouraged to adopt an individualized approach that respects the patient preferences while remaining grounded in the scientific evidence. Interdisciplinary teams comprising of the physicians, complementary therapists, and the researchers are optimal for developing the protocols that integrate both the domains, safety, and effectivity, as reported by, again, Smith et al. Now let's talk about the challenges and future directions. Now, despite promising results, several challenges persist in the integration of the modern and complementary medicine. Heterogeneity in the study design, small sample sizes, and variability in the treatment protocols often limit the generalizability of the research findings. Moreover, the need for standardized quality control in the alternative therapies remain a critical concern. Future research, therefore, should focus on the large-scale multi-center trials that can robustly evaluate the efficacy and safety of the integrative treatments. Advancement in the personalized medicine and genomics may further refine the selection of therapies, ensuring that patients receive tailored interventions that maximize benefits and minimize the risks, as reported by Johnson. So we can say that integrative medicine, in fact, represent a frontier in the healthcare that bridges the gap between the modern evidence-based practice and the time-honored alternative modalities. So while challenges remain, the scientific evidence supporting such an approach is steadily growing. And we believe that fostering a collaboration between the conventional and complementary discipline may allow the healthcare providers to deliver a more holistic and effective care that meets the diverse needs of the patients in an increasingly complex medical landscape.